Really important topic this morning. We're talking about colorectal cancer and, most importantly, screening as it relates to it. And I'm delighted to welcome to the program Jana Darlington from the Cancer Services Program of the Finger Lakes region, along with Dr. Mark Belfer, who is the Chief Medical Officer for the Greater Rochester Independent Practice Association, affiliated with Rochester Regional Health, and Dr. Danielle Marino, who is a gastroenterologist at the University of Rochester Medical Center. Thank you all for coming in.
Thank you for inviting us.
Jana, I want to start with you. There's an initiative, it's called 80% in the community. What's the idea behind this?
The idea behind this is to get everybody in the community screened for colorectal cancer at 80%. So we want everyone who's eligible for that screening to come in and, really have that done. So like Dr. Marino is going to talk about, the best test is any test. So we're really making a push across the state and across the country to get people screened for colorectal cancer.
What is the Cancer Services Program offering that's allowing everybody to have this opportunity to get this all-important screening?
So the Cancer Services Program of the Finger Lakes region is offering FITs and also colonoscopies if necessary for people who are uninsured and over the age of 50. So if they have any need to come in and have that test done, they can give us a call and we'll get them set up with our program to have that test done.
Dr. Belfer, let's talk about who needs to get screened when we talk about colorectal cancer.
Everybody at average risk over age 50 needs to be screened. It is one of the easiest cancers to prevent because it's easily found with testing. Last year there were about 800 people in upstate New York who died from colorectal cancer. There's no reason for that. It's the second leading cause of cancer death in the country. There's no reason for that. This is an easily preventable disease. The treatment is much tougher than prevention. So what we're asking is everybody to be tested. FIT testing, or the fecal immunochemical test, very simple test done at home. There's no reason that everybody couldn't do it because everybody goes every day or so. So that's an easy test to do at home. If that's positive, you have to have a colonoscopy. And Danielle will talk a little bit more about colonoscopy, but even that is a test that is not that tough to do. I personally have had 2 of them, and I can tell you that it is not a big deal.
Dr. Marino, obviously prevention is the key word here. It's in the offing for people who get screened, but there's more than that. There's more to it than that, especially as it relates to a colonoscopy, correct?
Yeah, so some people are really nervous about getting colonoscopy. The idea of it is a little uncomfortable, but what I always tell my patients is that the act of having a colonoscopy, the cleaning out the day before and actually having the colonoscopy is way less uncomfortable than if you developed colon cancer. So like Dr. Belfer said, this is something that's preventable, and there's no reason people should be developing it. As long as they come for screening, most cases can be prevented. So during the colonoscopy, we make sure that people are comfortable. We give sedation, and usually my patients wake up and they're like, that's it? I'm done? And I say, tell your friends, because people are nervous about it, but once they do it, they usually say it's really not a big deal.
Bottom line, this is a life-saving measure that we're encouraging people to take that step, right?
Absolutely.
Absolutely.
All right. Thank you all for coming in. Our time is short, but we appreciate your time. It's so valuable, and this important message for our viewers. Want to mention as we go, there's a great event coming up later this morning at 11 o'clock at the Central Library in Rochester. It's called Cancer Doesn't Care, We Do. All of these folks will be there with all sorts of important information for you as you consider getting screened for colorectal cancer, which we strongly encourage you do. If you missed any of our conversation, and I do want to mention this phone number before we go, the Cancer Services Program, for more information, Jana mentioned it, 585-224-3070. That number and more information on our site as well at rochesterfirst.com.